Welcome and a very good day to everyone. We are going to present about compartment syndrome. So let's move on to the content. There is definition, description, prevalence, clinical features, map condition to ICF, frame of reference, intervention, and also conclusion. So what is a compartment? Compartment is a closed area of muscle group, nerve and blood vessels surrounded by fascia. Muscles are arranged in different compartments and surrounded by one fascia. This arrangement is called osteofacial compartment. Normal compartment pressure is from 5 to 15 mmHg, while intracompartmental pressure will rise to 35 to 40 mmHg. Compartment syndrome is a condition that occurs when injury causes generalized painful swelling and increased pressure within a compartment. This pressure will decrease blood flow, which prevents nourishment and oxygen from reaching the nerve and muscle cells. For the prevalence of compartment syndrome, the most common studied site of compartment syndrome is the anterior distal lower extremity. About 2 to 12% of compartment syndrome is common in tibial fracture. Acute compartment syndrome are commonly in males, and men were 10 times more likely to suffer acute compartment syndrome than women. 31.9% of 286 persons with leg pain were classified as chronic compartment syndrome, with a symptom range from very mild to severe. There are two types of compartment syndrome. First, acute compartment syndrome. It happens usually after a fracture or severe injury. It is a medical emergency and requires urgent treatment. It can lead to permanent muscle damage if not treated quickly. The classic sign of ACS is pain, when the muscle within the compartment is stretched and burning sensation occurred. Second is the chronic compartment syndrome. It happens usually after repetitive exercise. It is not medical emergency and it does not cause permanent damage, and most often caused by athlete exertion, and CCS may cause pain or cramping during exercise. The pain will subside when the activity stops.
Okay, next is clinical features. For acute compartment syndrome, there will be a new and persistent deep ache in your arm or leg, feeling of pain, numbness or swelling. For chronic compartment syndrome, there will be a worsening of aching in the affected muscle.
This is the map of condition according to ICF. Compartment syndrome commonly have an issue with the body structure, such as pain, range of motion, muscle weakness, paresthesia, edema, and also have a limitation in the mobility and activity of daily living. It also affects the participation in works and recreation. The environmental factor and personal factor also interrelated to their health condition.
Next, we go into the frame of reference. There are biomechanical FOR and rehabilitative FOR. For the biomechanical, it focusing on impairments that limits the occupational performance. And while for the rehabilitative FOR is focusing on the remaining abilities and in achieving the highest level of functioning. Next is the management. Right, so for acute compartment syndrome, emergency surgery is required when the pressure is greater than 30 mm mercury. Hence, an urgent decompression is needed to lower the pressure, and usually occupational therapy will play a role in the post-operative phase.
Next is OT intervention. Occupational therapy assessment is considered in relation to splint, pain management, scar management, edema management, sensory education, range of motion, strengthening activity of daily living, assistive device, and patient education. The first occupational therapy intervention is Splint. Splint is a custom-made medical device used to treat orthopedic problems. The aim of the splint is to position correctly. Second, to prevent contracture, deformity, and loss of function. So, here is the example of the type of the splint that will be provided according to the injury.
Next is pain management. For pain management, the focus is to enable individuals to achieve satisfying performance in doing their activities. Hence, activities such as activity management, compression therapy, environmental modification, and also educational session for the patient is used.
Next is the scar management. The aim of the scar management is to soften the scar, to improve cosmetic outcome, to prevent contracture, and to reduce pain and discomfort. So here's the technique of scar massage. The fourth intervention is the edema management. It is to reduce swelling and to prevent permanent stiffness. So here's the technique to reduce edema. First, retrograde massage, and second, rise approach.
Next is sensory re-education with the use of adaptive or compensatory techniques, active sensory training, and also passive sensory training. After that, we have range of motion activity. It can be passive range of motion exercise or active range of motion exercises.
Next is the strengthening activity. It is to improve the strength of the affected hand. So, here's the example of activity that can be provided for the patient, such as fine motor activity with resistance. Lastly is the patient education on ADL activity. It is to maintain function independency in activity of daily living. Occupational therapists can suggest use of assistive devices in order to assist people who have difficulty to perform activity of daily living. It can be applied in different situations, including dressing, eating, toileting, and mobility. The purpose of assistive devices is to promote joint protection and promote higher participation in activity of daily living.
In conclusion, although there are two types of compartment mentioned in the video, which is the acute compartment syndrome and chronic compartment syndrome, it may also develop in other parts of body such as the abdominal, chest, and head. And it may also occur in multiple compartments, and it is called polycompartment syndrome. And occupational therapy roles and intervention may differ with each patient.
Audio Jungle.